This is a special report from WDHN News.
Good morning, I'm Sarah Drake, and we are interrupting regular programming right now to take you live to Montgomery. This is where Governor Kay Ivey will be joined by state health officials and members of the coronavirus task force. She's expected to announce how the state will gradually phase in businesses. Now, Alabama's current stay-at-home order will run through the end of this month. That's this Thursday. Alabama was placed under a restrictive order back on April 4th due to the rising number of COVID-19 numbers across the state. You can see right here she's at the podium, so we are going to go ahead and take this live.
Well, good morning, everyone. As you can see, I've got a great team assembled with me here today, and I am certainly grateful for each one of their service and their participation in this process. I'm here to speak today about our stay-at-home order that expires Thursday, April 30th. First, we couldn't even be here talking about this order that expires if it had not been for the people of Alabama abiding by the regulations and guidelines, for their sacrifices, their patience, and their understanding during the last 6 weeks. What our citizens have done is working, and I appreciate that so many people have been willing to do the right things to keep themselves healthy, as well as to protect others to be well and healthy too. And this has not been an easy process, and we are not well in a perfect world that we want to be. However, the people of Alabama are doing the hard things to ensure that we can get back to our routines just as soon as possible. And today, we're taking another step in that direction. Before I announce the changes that we're making, I'd like to first acknowledge a few people that are with me today. Dr. Harris continues to be a great partner in this venture, and I know it's not been an easy task, but I sure do thank you, Dr. Harris, for your wise counsel and your realistic approach, as you have provided great leadership for us during this process. Your measured and balanced approach have given the people of Alabama confidence, the people that you and I both serve, and I know I'm not alone in expressing our gratitude for your leadership during this time. Dr. Harris has worked diligently to ensure that we have more testing capabilities. And as we work to begin re-entry into our workplaces and return to daily routines, it is essential that we keep monitoring those infected with the COVID-19. Reopening Alabama's economy is certainly not as simple as flipping a switch or snapping your fingers. Like any good leader should, I have sought counsel from many avenues and received many, many recommendations. In fact, these are just some of the many reports and suggestions that we received in the last few days, from the Small Business Commission to each member of our congressional delegation in Washington. These suggestions are very broad and included many different scenarios, but I truly appreciate every one of them and the hard work and partnership that they represent. The 7 members of the Executive Committee of my Coronavirus Task Force are here with me today, and these folks have been diligently working to help me incorporate these ideas into the plan. This Executive Committee, led by my Finance Director, Kelly Butler, has recommended to me a thoughtful, well-planned timetable on how we can open our economy back up. On April 30th, our current stay-at-home order will expire. Issuing this order in the first place was not something I did lightly, and it was extremely difficult to tell businesses to close their doors. But it was done out of a need to get a handle on the spread of this virus. On March 13th, I originally issued guidelines, strongly urged recommendations, you might say, that if we all just did our part, then hopefully that would have been enough. At that time, I spoke about my reluctance to issue a stay-at-home order because I've always known that if the government kills a business, Washington can't print enough money to bring it back to life. I offered a solution that was based on the information we had at the time to slow the spread and to mitigate the once predicted hospital surge. Folks, I believe that all business is essential and truly regret any suggestion to the contrary. No matter the size, if you are conducting commerce and providing a paycheck, you have tremendous value to our state. On March 13th, we selected a list of specific businesses to remain open based on their risk of spreading the virus due to specific functions. Our intent was never to pick winners and losers, as some have wrongly suggested. We entered a safer at home recommendation on March 27 that we hoped would eliminate the need for a stay-at-home order. But unfortunately, it did not. For that reason, we enacted a stay-at-home order on April the 4th due to the continued spread of the virus and the fear of hospital surge. As of this week, we no longer believe our hospitals will see an overwhelming amount of ICU patients who need ventilators as we once believed, and that is sure good news for sure. While we have not seen a decrease in the amount of newly diagnosed COVID-19 patients, we have seen stabilization, a leveling off, if you will, in the amount of cases. Like everyone else, I look forward to easing back into our routines with caution. Just like we eased into this current stay-at-home order, we will also be thoughtful and careful as we ease back into our social interactions. Today, I am announcing that we will once again enter a safer at-home order that will still require social distancing and urge our people to continue taking all health precautions necessary as some people will return to the workplace. And while maintaining focus on our personal health, it's now time that we also focus on our economic health. And this, too, will be a thoughtful, methodical process. My fellow Alabamians, I am pleased to say that because of the efforts during these unprecedented days, we can roll back many of the restrictions that have been placed upon certain social gatherings and businesses. On April 30th at 5 p.m., our safer at home order will go into effect. All individuals, and especially vulnerable persons, are encouraged to exercise personal responsibility in slowing down the spread of COVID-19 by minimizing travel outside the home. You will be urged to wear face coverings around people from other households when you leave your house. Obviously, no one's going to arrest you if you don't, but it's just good, sound medical advice, and it's for your safety as well as for the safety of those with whom you come in contact. You are also urged to continue proper hand washing and other common sense hygiene. All non-work related gatherings of 10 persons or more, or non-work gatherings of any size that cannot maintain a consistent 6-foot distance between persons are prohibited. However, some top-level changes in this new order are as follows. Employers should take reasonable steps for employees to avoid gatherings of 10 persons or more, to practice social distancing, and make strong efforts to disinfect their office space. Under this less restrictive order, all retail businesses will be allowed to open with a 50% occupancy rate and not allow customers to congregate within 6 feet of one another. Our state beaches will be open, providing people abide by social distancing and the gatherings guidelines. And the mayors of our coastal towns have assured me they will take the lead and be proactive in enforcing the gathering guidelines. Elective medical procedures can resume. if providers take reasonable guidelines from their state regulatory boards or CDC guidance. My fellow Alabamians, let me be abundantly clear. The threat of COVID-19 is not over. We're still seeing the virus spread, and all of our people are susceptible to the infection. The greatest disservice for the people who might be watching me here today is to think that by lifting the comprehensive health restrictions, that this must be a sign that there's no longer a threat of COVID-19. Folks, we must continue to be vigilant in our social distancing both today and for the foreseeable future. And I encourage everyone to practice productive teleworking if possible, and be as innovative as you can as you open your workplaces. Ensure you're taking every precaution while getting back to work. It's certainly been a challenging month for sure, but better days are ahead of us, I'm sure of that. And I just want to thank the people of Alabama for being disciplined and patient as we move into what I hope will be a better season for our state. Now let me call on Dr. Harris to give his update. Dr. Harris.
Thank you, Governor. Thank you very much. Good morning, everyone. Let me just briefly remind you where we are right now. We're around 6,600 confirmed cases. That's over the last month and a half, with about 242 deaths so far reported here in Alabama. Like we have mentioned to you before, we see that our African-American Alabamians are disproportionately represented in those deaths. They represent close to half of those deaths, and that is because we believe this disease does have a predilection for people that have chronic health problems, diabetes and heart disease, and seniors, and so on. And so we recognize that these are still vulnerable people that we still need to protect. And also, I certainly do agree it's very reasonable for us to begin a gradual opening like this. I really appreciate Governor Ivey and what she has done on this. This has just been really, really difficult decisions, and she's done a terrific job of keeping everyone safe and trying to balance all those factors that are important. We believe there are certain types of activities that it is safe for Alabamians to resume. Clearly, people certainly do need to return to work, and we want to make that as safe as we possibly can do. We feel like we have seen a number of improvements recently, as the Governor mentioned to you. Our case numbers are relatively flat. We are somewhere around a couple of hundred cases a day. Over the past few days, we've seen numbers of about 148, 209, 189, 261, and so on. So we occasionally are a little higher, a little lower, but tend to stay around that baseline of around a couple of hundred cases a day. The deaths that we have seen have been fairly flat as well. We continue to see some of those, unfortunately, but they're certainly not accelerating at those rates like we saw earlier on. We're very pleased at how hospitals have been able to preserve their capacity. They have not had ventilator shortages like we had thought, or when they have had that short term, they've been able to share among themselves and manage that. We do have adequate ICU beds and the ability to care for people within the four walls of the hospital, and have not needed the alternative care sites that we had prepared for. So all these things are very encouraging to us. We've mentioned more than once to you about the White House gating criteria for moving to a phase 1 opening of the economy. We have met 2 of those 3 gating criteria. We have not met all of those criteria. We feel good about the criteria related to symptoms, the criteria related to hospital capacity. We have yet to meet the 14-day sustained decline that is recommended in those guidelines, and I would say for that reason we are not proceeding to the full Phase 1 opening consistent with the White House plan. The White House plan suggested opening entertainment venues and gyms and restaurants and a number of other things that we're not doing at this time. But we do think what the governor mentioned to you earlier is exactly the right approach. It's a very gradual and reasonable way for us to safely get people back to work and get the economy going again. And we will continue to monitor the case numbers that we have, and as people get back to work and get back out in public again, we certainly hope they can maintain the things that they need to do to keep us all safe and healthy. We believe that a gradual reopening makes a lot of sense, but as Governor Ivey mentioned, this really is up to the people of Alabama to keep doing the right thing as they have been doing so far. I have appreciated so much the efforts that I've seen from people. So many folks have really done their very best to make sure that they're keeping themselves safe and keeping their family members safe, and we realize that that has been done at great personal cost for many of them. And so even as we open things back up, we need to continue to ask Alabamians to work with us, to continue to do things a little bit differently for the future. As the governor mentioned, we are going to recommend that people wear face coverings like this or like those that you can make at home when you're going to be out in groups of people that you're not related to, or when you can't maintain a 6-foot distance between people. For a number of reasons, this was not an order, but this is a very strong recommendation, and we think it's the right thing to do, and we want all of you to do that. This is the mask I wore in the car on the way up here, and this is what I wear when I go out for takeout, and I would encourage all of you to do those sort of things as well. Most importantly, please remember that we need to protect the most vulnerable people in our society. We have seniors who represent about 3/4 of all the deaths that we have seen so far, but we have a lot of people with chronic disease in our state, people with diabetes and with heart disease and with lung disease, and we know that those people are much more likely to do poorly if they're exposed. So please keep that in mind. Even if you don't feel that you yourself are at risk from this disease, please think about your loved ones, think about those that you care about, and try to protect them as well. We know that we have a ways to go to get completely back where we were, but I think we're moving in exactly the right direction and exactly the right speed. We know there are some close contact professions out there that we have not addressed today. Those jobs where people literally put their hands on their customers are certainly a risk category that's different from other types of businesses, and we hope to be able to address that very soon. We know people continue to have a lot of questions about that. I'll be glad to mention to you later, if you like, about what we're doing around testing and contact tracing. We've done some very good things in those areas and believe that we're moving in the right direction there as well. So again, just thank you to everyone for what you've done so far, and we really appreciate all the efforts. And thank you, Governor Ivey, for what you're doing as well.
Thank you, Dr. Harris. As I mentioned earlier, Dr. Harris, assisting Dr. Harris and me in sifting through all of these recommendations and bringing some perspective to all of this has been the executive committee of my coronavirus task force. These are the folks that are standing behind me today. Leading this group of distinguished men and women has been Alabama's finance director, Kelly Butler. Kelly will make a few words on behalf of the executive committee. And if each member is interested and would like to introduce themselves and make a brief remark, then when we get to the questions and answers, you can certainly ask all of the members, and they'll be prepared to take your questions.
And you just heard Governor Ivey speaking on the current stay-at-home order that will expire this Thursday, April 30th, but then the safer at-home order will go into effect April 30th at 5 p.m. And some of the changes coming, retail stores now able to open. They are only subject to 50% occupancy rate, though. Medical procedures now allowed unless prohibited in the future by the state health office. Of course, restaurants still closed, so still have to get it carried out. But for now, I'm Sarah Drake, and we will have reactions on this coming up tonight on WDHN News at 5, 6, and 10 o'clock. So make sure you tune in. Thank you.
You've been watching a WDHN News special report. We now return to our regularly scheduled programming.